Do you have an ache or pain, but you're not sure what's causing the issue? And you're tired of doing random exercises or stretches, hoping that it magically fixes it? What if I told you it's easy to identify what exercises or stretches will help you depending on what your true issue is? In this video, I'm going to help you identify the difference between a muscle problem and a joint problem. Knowing which type of problem you have makes it easier to determine, well, first, what the true issue is, but also helps you figure out what strategies will help most. Now, before I dive in, the best thing you can do, especially if you have a lot of pain, is seek a local McKenzie Method practitioner. They'll be able to identify your problem and give you the right strategies right away. But if you don't have one nearby, or you're just curious how to determine the difference between the two, there are a few things that you need to understand to have a better idea. The first thing we need to discuss is what we call opening angle versus closing angle discomfort or pain. So what I mean by angle is the angle of the joint or angle of the movement. So I'm going to use my neck for instance because it's easy to see. So if I take my left ear towards my left shoulder, I'm noting if I'm getting discomfort on the opening angle or the closing angle. Usually, especially with a joint issue, you're gonna have closing angle discomfort where you might feel pain or a pinching sensation when going into the joint. But if it's a muscle issue, usually you'll have a ton of tension or even pain pulling as you go away. And that's the same for most joints. For instance, the shoulder, if I come up into flexion, I start to feel a pinching pain here. That usually indicates that there's some sort of impingement going on, which is a joint specific issue. So stretching the muscles or training the rotator cuffs isn't gonna help. But if you can go into this range, no problem, but you take that shoulder behind you, it starts to poke at your symptoms, then it could be something like a bicep tendon or more of a soft tissue or muscle issue causing that. So hopefully that makes sense to you because that's 101 to help determine on your own whether you're dealing with muscle or joint. Or the biggest telltale sign that you're having a joint issue is if you've tried muscle stretches or even treatments such as massage and they don't help long term. So let's say you do a stretch, it feels like it hits your symptoms, or even if you get like a lacrosse ball or have a partner dig into the muscle knots for you and it feels good for a couple hours or even a day, but then it just keeps coming back over and over again, that's a telltale sign that you have a joint issue that's causing muscle guarding around that joint. Now, as someone who sees muscle and joint pain all day, it blows my mind how many PTs and even chiropractors out there will think that there's a muscle issue going on when muscles are dumb. They only do what they're told through the neurology. And what's the primary goal of muscles when it comes to movement? It's to move joints. So if you have a joint issue where the joint's not articulating the way it should, it's gonna cause some guarding of the muscles around that joint. So again, if you have that reoccurring tension and you can't seem to break that with stretching, then I want you to think there's a joint issue and you need a joint specific solution, whether it's stretches or exercises. All right, I'll get off my soapbox now. But the last point that I want you to know is you can have both of these at the same time. So I like to say to my patients, you can have ticks and fleas, but it just depends on what's winning. So for instance, with the neck here, I could have a ton of tension pulling on this side, which would be opening angle. But if I check out other movements such as extension, it gets pinchy, then no, you have both muscle and joint. But from my experience, usually it starts with the joint. If you have a joint that's not moving the way it should, then the muscle contraction's not gonna be ideal. So usually people that come to see me, they've tried random stuff they see online and it's a lot of like stretching and muscle work. So if that doesn't work, then you know you need to attack the joint first. And from my experience in the clinic, if joints are moving the way they should, muscles are at an optimal length. Once you solve the joint issue, the muscle tension just seems to vanish. So that's super important to know for those of you that just have chronic muscle tension and you can't seem to get to the bottom of it, especially you tried massage, you tried stretching, you throw BioFreeze or whatever on it. Just know you're barking up the wrong tree. And hopefully after watching this video, it helped you to determine that there's more to the musculoskeletal system than just the musculo. There's also skeletal in that equation, which most people overlook. Lastly, if you're having a lot of pain or tension in the front side of your hips, a lot of times people blame that on the hip flexor, but very rarely is it actually a hip flexor issue. So if you struggle with this and you want to figure out what joint stretches are going to help it, check out this video here.